Hi, I'm Scott Sanderson. I'm the Section Chief of Neurosurgery at Danbury and New Milford Hospital and the Chairman of Neurosciences at Putnam Hospital. We have some very important structures, particularly the spinal cord. The spinal cord is the important fiber bundle that takes information from our brain to our arms and legs. The more common way that people get a spinal cord injury is from the overgrowth of bone and ligament that we see in arthritis throughout the body, just pinching the neighboring structure, which is the spinal cord. And the symptoms of that are somewhat insidious. The most common symptoms of spinal cord compression, and that diagnosis called cervical myelopathy, are numbness of the fingers, some weakness of the hands, loss of fine motor control and dexterity. For example, patients may notice they have trouble putting on their earrings or getting keys out of their pocket. And these are things that, because they don't create a lot of pain, people don't even know that it's coming from their neck. Another common diagnosis that we see is something called spinal stenosis. Spinal stenosis means narrowing of the nerves that go down the lower back and into the legs. The way I like to describe it is the nerves that are going down the spine are like cooked spaghetti in a baggie of water. And the arthritis pinches that baggie. And all of those nerves get squished together. And when they get squished together, it gives symptoms into the buttocks or thighs or calves. The symptoms of spinal stenosis are pretty classic. People get symptoms in their back and into their buttocks or thighs or calves when they stand and walk. A lot of the patients with spinal stenosis will be better flexing forward as well. So if our patients say, well, they can only walk 100 feet and then they need to sit down or flex forward, that's very characteristic of spinal stenosis. When the spinal cord is compressed, it typically needs to have surgery. Our main surgery for spinal stenosis is something called a laminectomy. A laminectomy is an incision in the lower back, and we remove a bunch of that arthritic bone, and we allow that sac of nerves, that cooked spaghetti in a baggie of water, to expand back out. Once we relieve the pressure on the nerves, most people get significant improvement in their buttock and leg symptoms. After most of our surgeries, most people need to be cautious for about 6 weeks or so. After that, we start allowing them to resume their normal activities, everything in moderation. Thank you for spending some time with me. My name is Scott Sanderson. I'm a neurosurgeon at Elite Brain and Spine. And if you have symptoms that you think needs a neurosurgeon evaluation, please reach out to us.